Hey, welcome back to the Build Beyond podcast. I'm coming to you from inside the gym today. If you're watching this, you'll be able to see the background. I'm actually sitting on a Concept 2 rower right now. I've got a little gap between patients. There's a gap between classes here. So I'm just taking a minute to record this brief episode based on a conversation that I had last week. On my intake forms, I ask questions about women's health. So specifically, I'm asking about pregnancies, menstrual cycle, and things like that. Most people, I think, find that a little odd that I ask those questions. And sometimes people skip them altogether. And I think people skip them probably most commonly because they don't feel like it's relevant. So for example, if you're coming in for tennis elbow, and I'm asking questions about your menstrual cycle, what does that have to do with it? And I don't usually let people slide with that. So I'll ask the questions in person. And I think initially when I started doing this, it was pretty awkward. I don't feel awkward about it at all anymore because I'm so used to asking these questions. And I'm pretty good at explaining why I ask the questions. And I think once people understand the why, they get they're more open to sharing. And I think this is really important for women, but it's also important for men. And obviously, biological males, they don't have menstrual cycles, so these questions aren't relevant. But what I'm screening for is relevant because it happens to men. So this is this is called a relative energy deficit syndrome, REDS. And what ends up happening, and this is stereotypically a female thing, but as I said, this happens to males as well. In sports that are that have a higher emphasis on aesthetics, so gymnastics, track and field. I think I've seen this in volleyball, women's volleyball. It's not limited to these sports, but especially for young women, if they feel like they're being judged on their weight, either for purposes of presentation, so for gymnastics, or just because of the way they look in their uniforms, there is a tendency to eat less, so decrease their overall caloric intake. We can do that for a while, but the problem is with highly active people, especially athletes, they have a very high energy requirement. And if the caloric intake goes down, and that happens long enough, the body has to compensate. And for women, we'll see loss of a menstrual cycle or some drastic changes in the menstrual cycle. We'll see decreased bone density. And typically, there is some type of disordered eating pattern. Maybe not a full-blown eating disorder, but we'll just say disordered eating. Now, obviously, if this is happening in a male, there's not going to be a loss of the menstrual cycle, but we can still see disordered eating and then a decrease in bone density. Now, why does this matter, let's say, for elbow pain? Well, if someone comes in, and let's say that person has a disordered eating pattern, they are not eating enough to adequately sustain their physical activity and their training. Well, what's going to happen? When we go to the gym, we're not really getting stronger in the gym. We're not really getting stronger during training. It's the recovery process after. So we lift heavy weights, or we sprint, or we do hard things for the opportunity to recover so that we can improve. But the recovery process requires a couple things. It requires sleep and nutrition are two of the big ones. Stress can obviously have an effect on it as well. And I like the analogy of think about if we were going to remodel a bathroom. You could go in and you could hire a crew to demo the bathroom. They'll go in and they'll just rip out everything. Well, if you after that, you would need to buy supplies, and you would need to give adequate time for the contractor to rebuild the bathroom. So if you, let's say you don't buy any supplies, a crew just comes through and demos the bathroom. You don't buy any new supplies, and you come back 2 days later and you're upset with the contractor because the bathroom's not redone. The contractor's going to say, well, you didn't give me the time that I needed, and you didn't give me the supplies that I needed. And I think that's what ends up happening to a lot of athletes or a lot of people who have chronic injuries. If they have a disordered eating pattern where they're not eating enough calories, then they will start to become injury prone. It's hard to recover from things because they're going out and they're being physically active and they're breaking down a lot of tissue, but chronically they're not putting in the nutrients that you need to rebuild that tissue. So the person that came in, I want to protect this person's identity, so I'll just be very broad with this, but I've seen this with a lot of different sports. So this person was a former, I can't remember if it was a former gymnast or figure skater or dancer. It was one of those. And so one of the questions I have is, anyone ever recommended that you lose or gain weight? And she had put that it was recommended that she gain weight. And I have a question on there that says, have you ever suffered from an eating disorder? And she put, I don't know. And so I've got a sporting history where this athlete or this former athlete is competing in sports where we see this more often. And then all these other things are lining up. This athlete or this young woman also didn't fill out anything about her menstrual cycle. So I didn't know if she didn't understand or if she was hiding something, or if she, you know what I mean? So I knew that was a conversation when she came in I was going to have with her. So there were a lot of things adding up. And she was coming in for something like elbow pain or wrist pain, hand pain. I don't remember exactly what it was specifically, but it wasn't anything you would think would be connected to the menstrual cycle. And I think, long story short, with this person, I don't think that she necessarily has this problem, but I think she's been on this path as an athlete for quite some time where if she doesn't have it now, she's going in a direction that I don't like. So we had to have that conversation. And you can see the potential harmful effects of this. If you're not eating enough and you're starting to lose bone density and it's starting to affect your menstrual cycle. Well, if you have decreased bone density, you're at more of a risk for some type of catastrophic fracture. Well, that's not good. And there's all different other things that are going on. Your body is obviously, when you're losing bone density, there's many mechanisms that are contributing to that. And your body is trying to stay alive, trying to keep the heart going, trying to keep the brain going, you're trying to keep the vital organs going. And you're not putting those resources back into your bones. You're not putting those resources into menstruation. And that's a problem. It's a problem, especially if you want to have kids. Even if you're done having kids, there are so many other health problems that could go along with this. And I think as a healthcare provider, especially someone who deals a lot with athletes and active people, it's easy to only get focused on the performance and be like, okay, so you've got elbow pain. Is it a tendon? Is it a muscle? Which tendon? Which muscle? Is it? What's going on? So we can look right at the elbow. But the key to being, I think, good at this as a healthcare provider is I have to be able to step back and think about, okay, what about the health of the athlete? Because who cares if I help someone with their elbow pain if they're going down a path where they might not be able to have kids someday, or they might have like a femur fracture because of low bone density. That's just not something. It's not a good trade-off. So when we identify someone who might be going down this path, it's not something I could diagnose. I just recognize the signs and symptoms, and then I have to get a healthcare team together. So the primary leader of this needs to be a physician. We need a registered dietitian, nutritionist, someone to go over the food aspect. We're going to need a mental health provider to at least screen for an eating disorder. And then those three are going to be kind of the primary, and we're going to need to order stuff. So, and this is all stuff the physician would order, but we want a DEXA scan to look at bone density. We'll look at BMI. We'll look at how the pituitary gland's functioning, the thyroid gland is functioning. We're probably going to want a pregnancy test. We'll want to assess vitamin D and calcium. So that from the medical side, that medical doctor is going to play a huge role. And then we need that mental health provider also helping, and then that nutritionist getting them eating again. And again, this is like these people are all going to be combining together on behalf of this athlete to help him or her get healthy again and then get back to sport. Also, we have to loop in the coach and the athletic director, because there's going to have to be somewhat of a contract with the athlete and the coach, where the athlete is going to have to meet certain requirements, probably set by the physician, before that athlete can start training again, because we don't want them expending more calories when they're not putting the calories back in. And it's hard too, because at the same time, this has to be communicated well, because there could be a mental health issue going on. So that's where the mental health professional comes in. And also there are more complex things at play here. If the athlete is being paid, if this is a professional athlete, if it's a collegiate athlete on some type of scholarship, if it's an athlete who's about to get a scholarship or a professional contract, is this just a busy mom who is struggling with all these things, and she's got kids and she's got a job? So how do we get that team together, and how do they work in unison to get the person what they want? And so I think that's kind of more of the role that I play. So I identify these, I help put together the team, and I try and broker those relationships the best that I can and play whatever role is appropriate. But I'm definitely not the quarterback for this. I'm usually just one of the people who recognize it. And this is common. I've seen this dozens of times since I've been in practice. All right, I hope this has been helpful.